Welcome to Magnolia Medical Minutes, your local source for expert medical insight direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of SuperTalk Mississippi Media, and today's special guest is emergency medicine physician, Dr. Lisa Bundy. Thanks for joining us today.
Sure.
Today's topic is head injuries. So when should I worry about a head injury?
So symptoms we look for with serious head injuries would be altered mental status, any neurologic deficit, vomiting, seizure activity, loss of consciousness. Those are things to worry about.
Are there differences in children and adults' head injuries?
In children, we use a decision-making tool called PCARN, and so that way we can have a list of things we look for in kids. And adults, one of the biggest things we find in adults is the use of blood thinners, because a lot of older patients are on blood thinners, and that certainly does increase the risk for an issue when they have a head injury.
Tell me exactly what is a concussion, and can you see that on imaging?
A concussion is basically a blow to the head, and they can cause a lot of different symptoms. But you won't necessarily see it on imaging. When we do a CAT scan in the emergency department for someone who has had a head injury and has some risk factors, we're looking for bleeding on the brain or a skull fracture.
So you actually don't see the concussion itself?
Not necessarily.
What are the symptoms of concussion, and how long do they typically last?
So symptoms can include memory loss, difficulty concentration, difficulty with sleep, mild headaches, nausea, and they last maybe about 2 weeks. Usually I tell patients if they have symptoms more than 2 weeks, then they should follow up with a neurologist.
Lastly, what is the best way to prevent major head injuries?
So anytime you get on a bike or any kind of motorized vehicle, helmets when you're vulnerable are gonna really prevent those head injuries. I tell kids all the time, I can fix bones, I can't fix your brain. It's a lot harder.
Well, thank you for joining us today.
Sure.
Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical insight direct from providers at MRHC in Corinth.